Every morning when I wake up with the sound of the alarm, I will hear the sound of my heart pumping. And like the clock, the rhythm will start my busy day. I may run to my mechanic to fix my car and run to my dentist to fix my teeth. And for sure, I have to run to my office to make sure my clients are taken care of. And like a clock, the rhythm of my heart follows my every step. But unlike a clock, my heart rhythm carries a different tune. It's calm and relaxed when I enjoy a good massage. It beats like a drum when I fight for myself or my clients. And it will jump like a deer when I find my dream girl. My heart works hard and never gets a break. Unlike my legs crying out after my fitness run, or my eyes losing focus even at critical moments. My heart stays with me through good times and bad. But even a heart as good as gold needs some tender care. A auto mechanic may fix 10 cars a day, but my heart doctor has to fix more than 100 hearts a day. You may have a bad heart, but that is not a big deal as long as you have a good doctor.
I have decided to be a doctor a long time ago. I want to fix people's broken hearts. Heart attacks can be a silent killer. Because your heart, it never complains. Sadly, when it breaks down, it is often too late. So what should we do? There are lots of things you can do. Actually, the more you do, the less I have to do. If your heart is not broken, I don't need to fix it. Because heart attack is a silent killer, you may not know to have heart problems, but you have to pay attention to symptoms. One common but often ignored symptom is chest pain. You may feel discomfort or pressure. Some may experience aching, pains in your chest. Many people will mistake the signs of burning, squeezing, or fullness as heartburn. Because some people feel pains in the shoulders, arms, neck, throat, jaw, or back. Some people may fail to realize the danger and consider them only as common cold or flu. Look, for heaven's sake, these symptoms may be very serious. Watch out when one of these symptoms appear. You may have coronary disease, shortness of breath, palpitation, that means irregular heartbeats, or a thick thought feeling in your chest, a faster heartbeat, weakness or dizziness, nausea, sweating. Of course, I don't mean for you to call 911 for emergency every time when one of three symptoms appear. However, you must call for help if you feel you may be having a heart attack, especially when you have these additional symptoms such as vomiting, extreme weakness, anxiety, rapid or irregular heartbeats, and sometimes near fainting or transient breakout sensation. A mild discomfort that progresses to significant pain. You may have a serious problem if the symptoms last longer than 30 minutes and not improve with rest or taking medications. Don't take a chance on your life. Get help. Go to hospital right away. Call ambulance. These symptoms are like alarms. Don't ignore them. A few people can have a heart attack without having any symptoms, the so-called silent myocardial infarction. Many diabetic patients lose their fights. We have to face difficulties of fighting the silent killer without symptoms. Although there may not be an alarm, there could still be signs. For example, you should know your heart needs attention when you see symptoms of arrhythmias. I mean a normal heart rhythm. When you notice palpitations, a feeling of skipped heartbeats, fluttering of thick tops of your chest, you will have fainting and feeling tight easily. together with the common symptoms like dizziness, shortness of breath, and chest discomfort. Meet with your healthcare professionals so they can alarm you against the silent killer. Ignore the risks does not make the problem go away. It only makes it worse. Some symptoms not only tell you that you are in trouble, it may also tell you that what kind of troubles you are in. For example, if you have difficulty catching your breath even while doing light everyday duties, and even when you rest, together with DDPP, I mean dizziness, discomfort, pain, and palpitation. This is what we call DDPP. I repeat, it means dizziness, discomfort, pain, and palpitations. You may have heart valve problems. If you find swelling of your ankles or feet, even your abdomen, or just feel bloated and with quick weight gain, like 2 or 3 pounds a day, you may having a heart failure. Some people may have heart muscle disease with so-called cardiomyopathy, which is very similar to palpitation, except the chest pain or pressure often occurs with exercise or physical activity and often occur with rest or after meals. Then there are symptoms of pericarditis. This is different from angina. Angina means chest pain caused by coronary disease. The pain of pericarditis may be sharp, but it is quite difficult to differentiate. Often felt in the center of the chest, patients may feel pain in neck, arms, and backs. The pain may be worse when you are lying down. Before help arrives, taking a deep breath in, coughing or swallowing. Try to sitting forward, call for help or get to the nearest hospital. Additional symptoms may include low-grade fever and increased heart rate. There may be many symptoms you should know and watch out for. But there is only one solution you need to keep in mind. This is to call for help. Don't wait till you pass out or are too weak to get to the phone. You are not sure if you really have a heart attack. At least call someone who can get to you and give you help. You may have a bad heart, but that is not a big deal as long as you have a good doctor. Trust me, a mended broken heart can be as good as new. I'm Dr. Chen. I hope that every person should pay attention to his health.
Thank you, Dr. Chen, for the care and support and technical advice given here. This is Ken Peters. Thank you for watching.